Hello students, myself Dr. Mariam. Let's get right in today's topic, that is renal stones. I hope you all are ready to explore it. So let's move on. So when discussing about the renal stone topic, so a kidney renal stone, or we can call this as a kidney stone. So a kidney stone or renal stone is also known as a renal calculus or nephrolith. It is a hard solid mass of a material that forms in the kidney from the substance in the urine. And kidney stones or the renal calculi, it develops as a result of various metabolic disorders which affect the fate of calcium and other mineral elements in the body. So if stones grow to a sufficient size, they can cause blockage of the ureter, and the stones may be formed in the kidney, urinary bladder, ureter and urethra. So basically the kidney stones are like a solid masses or crystals that form from the substances like minerals, acids and salts in the kidneys. So they can be as small as a grain of sand or rarely or larger than a golf ball also. And kidney stones, it is also called as I've mentioned, it is called as renal calculi or nephrolith, or we can call this condition as a nephrolithiasis. And depending on the size of the patient's kidney stones, the patient may not even realize that the patient may have one. Like for example, like smaller stones, it can pass through the urinary tract while the patient or the individual urinate with no symptoms. So larger the large kidney stones, it can get trapped in the ureter, that is the tube that drains urine from the kidney down to the bladder. So this can cause this urine to back up and limit the kidney's ability to filter waste from the body. It can also cause bleeding also, and it can take as long as 3 weeks or for kidney stones to pass on their own. And even some small stones can cause extreme pain as they go through the urinary tract and out of the body. So this is the basic introduction of what is a kidney stone or a renal stone. Moving on to the incidence. So incidence, the urinary calculi or the renal calculi are more common in men than in the women. And the incidence of the urinary calculi peaks between the third and the fifth decades of the life. And the 80% of stones is under 2 mm in size, and the 90% of the stone pass through the urinary system spontaneously. So this is the incidence. And moving on to etiology. So what causes the renal stones or the kidney stones? The first of all, the basic thing we have to keep in mind that our urine, or the like as an individual, our urine contains minerals, acids and other substances like calcium, sodium, oxalate and uric acids. So when the patient or when the individual have too many particles of these substances in the urine and too little liquid, then they can start to stick together forming crystals or stones. So this is how the kidney stones are formed over the months or years. And so basically, while talking about the etiology, most of the times we don't know what are the unknown like causes. So it like maybe because of any unknown causes also. Then others are gout, hyperparathyroidism, IBS, urinary tract infection, dehydration, crystal aggregation, etc. And the patient might be at higher risk of developing kidney stones if the patients don't drink enough fluids, eat meat and other protein rich foods, or eat foods which is high in sodium or sugars like sucrose and fructose, and take vitamin C tablets or supplements, and have a family history of kidney stones, or have a blockage in the urinary tract, or they can maybe because of the like had stomach or intestine surgery, like had a previous surgeries including the gastric bypass surgery. And maybe because of the imbalance, in case of the imbalance of pH in urine also, and being obese also. So these are the few conditions where the patient is at higher risk of developing the kidney stones. And there are medical conditions that increase the kidney stone risk, certain health conditions which can put the patient at a higher risk of kidney stones. Like these includes like cystic fibrosis, cystinuria. It is a genetic disorder that causes a buildup of cystine, and maybe because of diabetes and gout, as I've mentioned before. Then high blood pressure, high calcium levels in the urine, like hypercalciuria, and inflammatory bowel disease, kidney cyst, obesity, osteoporosis, parathyroid disease, primary hyperoxaluria, hemiplegia, or paraplegia. So these are the few certain medical conditions which can put the patient into the higher risk of kidney stones, of developing the kidney stones. So this is the etiology, or what are the causes of renal stones or kidney stones. Next, the types. So the stones are named for the types of crystals they are made up of. So it can be calcium oxalate, calcium phosphate, struvite or the triple stone, uric acid, and cystic. So calcium oxalate and calcium phosphate stones. So it is a calcium based stones which can form when the patient or the individual eat high oxalate or low calcium foods and are not drinking enough fluids. So the calcium stone, oxalate stones are the most common type of kidney stones. Next, uric acid stones. So eating animal proteins, beef, poultry, or like pork or eggs and fish can cause increased uric acid stones to form. And talking about these struvite stones, it is like, for example, like bacterial infections which can cause the struvite stones. So repeated infections can lead to a staghorn calculus. It is a very large kidney stone that usually needs to be surgically removed. Next is cystine stones or cystic stones. It is an inherited condition called as cystinuria causing the cystine stones. And cystine is a substance made up of two cysteine amino acids bound together. And there are few other than these, there are few other rarer types of kidney stones which can also occur, such as xanthine stones, dihydroxyadenine stone, silicate stones, etc. So now we have, like, the main types are these which I have mentioned now: calcium oxide or calcium phosphate, struvate or the triple stone, uric acid, and cystic. So these are the major important types of renal stone you have to keep in your mind. Next is the pathology. So, talking about the pathophysiology, highly concentrated urine constitutes the crystallized and hardened to form the calculi. And the kidney stones will be formed when our urine contains more crystal forming substances such as calcium oxalate, and uric acid. And at the same time, our urine may lack some substances that prevents the crystals from sticking together, creating an ideal environment for kidney stones to form. So the crystals get deposited on the nucleus and continue to grow, and these can sometimes lay adhere to the renal papillae. So this is how the formation of these stones are formed in the kidney. And so this is the pathophysiology of what is happening in the, like, how it is formed in the, how the kidney or renal calculi is formed. Next is clinical features or clinical manifestation. The most common symptom of kidney stones is pain in the lower back, belly, or the abdomen or the side, which means a flank pain. And it might feel like it extends from our groin to the side, and it can be a dull pain or sharp and severe. It's sometimes called as colicky pain because it can get worse in waves. So that is one of the most common pain, like symptom, which we can see in the patients who is having or developing a kidney stone renal calculi condition. Next, the other kidney stones or the renal stones symptoms are abdominal pain, fatigue, elevated temperature, BP and respirations, steady pain on urination, and the urine can be pink, red, or brown color oliguria and anuria and obstruction, hematuria, renal colic, hydronephrosis, cloudy or foul smelling urine, nausea and vomiting, and urinating small amounts of urine. So these are the clear clinical manifestation or the clinical features you can see in the patient who is having a kidney stone. And in cases of smaller kidney stones, that these smaller kidney stones may not cause much pain or any other symptoms. It maybe without even the person or the individual knowing, the stone might have might pass through the urine when the patient urinates. So in such conditions there will not be such kind of these clinical features which I have mentioned. These things the patient might not have faced. So in other cases, the patient may feel these any of these symptoms. So these are the clinical features of the renal calculi or renal kidney stones. Coming to the complications, so the kidney stones, it can put the patient into a higher risk, and a blockage which that backs the urine into the kidney, causing it to swell, that is the hydronephrosis. And kidney infections, that is pyelonephritis. Acute kidney injury, it is a type of kidney failure that can be reversible. Frequent urinary tract infections, and CKD, that is chronic kidney disease. So these are the complications which we can see in the conditions of the patient who's suffering from these renal calculi. Next is the diagnostic evaluation. So diagnostic evaluation, that what are the diagnoses we have to do. So initially blood test to check the kidney function, to detect the infections, and look for what are the levels of calcium or other conditions that could lead to a stone formation. Then urine analysis, cystoscopy, imaging techniques, that is X-ray, CT scans, MRI, and USG, and also while doing these imaging techniques, which can help the practitioner or the doctors to see the size, shape, and location, how many number of the stones present in the kidney. So doing these imaging techniques, we can diagnose the condition, and we can do intravenous urogram or intravenous pyelogram. So these are the diagnostic techniques you have to do while doing the while diagnosing the patient. And most important thing, the medical history and history of the patient, about the conditions and whether they had a family history, or and relating to all, and also about their health, whether they are diabetic, hypertensive, or hypertension, or whether they are in the regular medication for any such condition. So that also you have to get noted down while diagnosing the patient. Next is management. So management, coming to the management, if the patient have a small stone that is likely to pass on its own, the practitioner or the doctors will have to monitor the symptoms until it passes through the urine. So they might prescribe, so we can prescribe medications which can keep the patient comfortable and help the stone to pass on its own. So larger stones, when comes to the size, when the size of the stone is increased, whether that is the larger stones, it requires treatment depending on the size, location, and whether they are causing infections or symptoms and any other factors. So if the patient is having a larger stone or a blockage, or if a stone is not passing on its own in a few weeks, then the patient have to consult the doctor, and the practitioner or the doctor have to recommend the procedures to break up the stones, kidney stones, or we have to remove it. So if the patient is having a kidney stone that can pass on its own, it's and it's not causing an infection, we can prescribe some few medications, and for example, to relax the ureter to help the stone to pass. Commonly prescribed medications include tamsulosin and nifedipine, and we have to prescribe manage nausea. So these are the acute treatments. So acute treatments when it comes to the condition where the kidney stones might pass through the urine, and the patient is not getting affected with this type of kidney stones, and it is not causing any infection. So in these cases we can advise this acute treatment, that the we can prescribe the medicines like tamsulosin and nifedipine to relax the ureter to help the stone to pass, and spasmodic, for example buscopan, NSAIDs, for example steroid, and we have to maintain the input output charting, and we have to prescribe medication for managing nausea and vomiting and managing pain. Yeah, so even small stones that can pass on their own can be very painful, so we have to prescribe medications or make recommendations for the over counter medications to manage pain, and advise them to keep themselves hydrated, and strain urine for stones, and ambulation, diet instructions, and diet instructions we have to give, and we have to advise them what are the restrictions they have to follow, and emotional support and invasive procedures. In if necessary we can do invasive procedures also. And the medications like narcotic medications, loperamide for uric acid, diuretics can be advised, sodium bicarbonate or sodium citrate can be advised, and phosphorus solutions. So these are the medications we can advise for the patient in cases of acute treatments, like if the patient is not getting affected with the condition, or the stone or not getting or not, it's not, and the stone is not causing any infections, then you can prescribe or advise these acute treatments. Moving on to the surgical part. So surgical management in if the patient is having a kidney stone that can't pass on its own or is blocking the urinary tract, then we can recommend a procedure to break up or to remove the stone. So the type of procedure we can recommend depends on many factors, including the size and location of the stone, and the kidney stones procedures also. We have to see whether it is possible, what are the size and the location of the stone we have to know. Then only then we can advise them the surgical management. So the kidney stone procedures, which include shockwave lithotripsy. It is we uses a shock waves to break apart the stones from the outside of the body, and the fragments, that is the broken stones, which can move through the urinary tract and out of the patient's body more easily. And other treatments like ureteroscopy, that is we can insert a scope through the urethra and bladder and into the ureter, and the instruments which we passes through the scope can break up and remove the stone, and the smaller pieces can move through the urinary tract and out of the body more easily. Next is percutaneous nephrolithotomy, percutaneous lithotripsy. And in the case of percutaneous nephrolithotomy, we may recommend percutaneous nephrolithotomy when they can't, when we are not able to treat a kidney stone with the other procedures. So during the percutaneous nephrolithotomy, we insert a tube directly into the kidney through a tiny incision in the back, and an ultrasound probe breaks apart and removes the stones. So this is what is happening in the percutaneous nephrolithotomy procedure. Then we can do the laparoscopic surgery, during the laparoscopic surgery, we make a small incision to remove the stone. In some rare cases, we might need to perform a open surgery with a larger incision instead of a laparoscopy. So these are the surgical management we can advise we can do to the patient to manage if the kidney stone is very large, is not able to pass through the urine. We can advise the patient diagnosing their condition properly. After diagnosing their condition properly and checking for the size and location of the stone, then you can advise the surgical management procedures. Next is the prevention. So prevention, in case of prevention, how we can prevent this condition. So many of the patients who comes to us, they ask, can kidney stones go away on their own? Yes, around I think 80% of kidney stones can pass on their own. The amount of time it takes for the patient to pass a kidney stone depends on the size and location. So a stone that is smaller than 4 mm may pass within 1 or 2 weeks, or a larger stone could take about 2 to 3 weeks to completely pass. And once the stone reaches the bladder, it usually passes in a few days. So if the patient thinks that like they have a kidney stone, and like in cases, you have to advise the patient, if they have the feel they know that they have the kidney stone problems, ask them to consult the practitioner doctors and to check for any blockages or any other complications. So it is important to follow up with the practitioner or with the doctors, so if the patient do not pass the stone within the 4 to 6 weeks. And there are things which we eat and drink can impact the risk of kidney stone. So we have to advise them good dietic advices, and we can advise them to drink water, keep them hydrated, limiting animal proteins, limiting foods high in sugar and sodium, and limiting food high in oxalates. And if the patient have calcium oxalate stones, we have to recommend them to avoid foods like, for example, spinach, rhubarb, wheat bran, tree nuts, and peanuts and all. And we have to also advise the patient to maintain a weight that is healthy for the patient, eating foods that are good sources of calcium. While it may not seem like it, but foods high in calcium can help to prevent kidney stones. The same is not true for calcium supplements or antacids with calcium, so which can increase the risk of stones. And you have to advise them to take the prescribed medication. So if changes to the things does not work, or the patient does not get any relief, then we have to do advise the prescription or based medications which will help them to prevent the kidney stones. And the type of medication depends on these types of stones the patient get. So we have to make sure that diagnosing the condition is very important, and make sure you properly diagnose it, check for the size and location of the stone where it is present, and depending upon the evaluation and diagnostic techniques and all, give them the proper medications and advices for the further progression of the further relief of the disease for the patient. So this comes to the end of our topic, renal calculus or kidney stones or renal stones. Thank you.